Brought to you by Express Care Health and Skin Center. Get in, get out, get better.
Welcome back to the show. Far be it from us to prevent you from going to the beach this summer, but when you do, we want to make sure that you are safe, and Dr. Jitka Lom from Express Care is here once again. We got some really good questions, most of them having to do with jellyfish stings, which of course is a big concern right now, so let's go ahead and get to them. Question number one says, if I get stung by a jellyfish, Dr. Lom, will there always be a stinger stuck in my skin, kind of like if you get stung by a bee?
Not really. The stingers will land on your skin, so the first thing you should do is try to remove them using some kind of object like a credit card or some kind of scraper. Scrape it off your skin. Don't use a towel. Don't rub it into your skin. That's going to make it worse. Don't touch it with the other hand. Just use some object to scrape it off your skin. Then there are still the stingers. Those are called nematocysts. They're stuck inside your skin, and they're full of poison. And what releases the poison is either rubbing it or certain chemicals or just time. They'll rupture and they'll go into your skin. So you want to avoid that. So you can, if you can see anything, try to pick it off your skin or remove it. And then you should try to pour vinegar on your skin so that sort of allows those cysts to not open. That kind of deactivates them so they can't open. They can't release more poison into you. And then the third thing that you can do is take that part of your body and put it under hot water for about 20 minutes, as hot as you can tolerate. And again, that kind of reduces the amount of itch and the amount of toxic poison that gets into your body.
That's a very good point, because, you know, like Steve, one of our guys in the back, he said he's been through survival training, and he was saying, like, in the event that you don't actually have hot water or vinegar, you know, there's an urban myth that says you can pour maybe beer or even, you know, urinate on yourself, like if you get bit by a snake. Something like that. How much truth is to that?
Actually, it's not true. The idea about something hot, maybe urine, but there won't be a very long quantity of that. I don't think so. So I think as far as you know, if you don't have anything available, just try to remove it. If you try to put vinegar, or get to a place where you can get some baking soda, make a paste with some salty water, not with fresh water, but with salty water, and put that on. That also helps to kind of denature the jellyfish.
And also you might want to consider bringing a first aid kit, which we will get to shortly.
Sure.
As for question number 2, this person says, is it true that the ocean water is good for kids when they are sick or have eczema? We kind of touched on this in the last segment.
I think if your child has a fever, definitely don't take them to the ocean where it's hot and they're going to, again, have a chance of getting more dehydrated. It is helpful for people who have maybe colds or minor illnesses. It can be helpful. I wouldn't dip your head in, just dip your body in. And then as far as the skin conditions, if you have open sores, avoid the ocean. If you have dry skin conditions, make sure you put some Vaseline on before you get in the water.
And you want to pay attention to the EPA reports that come out weekly, because they will actually tell you which of Guam's public beaches are safe to go in or not. So make sure to check that out. All right, back to jellyfish stings. How long will my welts last? This next person asks. On my daughter's legs, is there anything to speed up the healing?
Oh, yes. You know, jellyfish stings can last a long time. In fact, some people have a delayed reaction, like they don't have anything right at the beginning, but about a week to 10 days later, they'll start itching from their jellyfish bite way back. So it can last a couple of weeks, and they look like, you know, whip marks. It looks like, you know, big red streaks on the skin. Be really itchy and sometimes painful. So you can actually use topical hydrocortisone, which you could buy over the counter, or a prescription steroid that's much stronger, or even oral steroid medicine like prednisone if the reaction is really severe, as well as taking Benadryl for the itching, and that would be oral Benadryl. I want to make this point because topical Benadryl, that's diphenhydramine, you know, they sell it as an anti-itch preparation. It really does not work very well for skin itching. The steroid medications will work much better. The topical Benadryl can actually sensitize you, and you can actually get itchier from using it. So avoid topical Benadryl. Use the oral one instead.
Is it more of a placebo, or does it just cool the skin? Or
it's you know, it works orally. It doesn't really work topically, but for some reason it's sold on the market.
Oh, okay. Well, you know, commercialism is what it is. All right. Next question. Is it true I shouldn't rub the area that's been stung? We touched on this previously.
Don't rub it, because that'll rupture more of those cysts and release more poison into your body. So try to scrape it off, remove it. If you can, pick it off with little tweezers or something. and then pour the vinegar on to denature it.
All right, and on that note, and the next question, we kind of answered this already. Is pee really good for jellyfish stings? Their words, not mine.
No,
I didn't know I could say that on the air.
That, meat tenderizer, alcohol, aloe vera, please avoid all of those things. The only thing, just remember this really easy thing, remember vinegar is good and baking soda is good. All the other things, don't.
What if you just don't have them and, you know, like
Yeah.
it's an emergency situation if you have
If you don't
beer
have
or
them,
soda?
Yeah, if you don't have them, rinse off with salt water. Again, fresh water can release more of that poison into your body, so the typical reaction would be running from the beach to the shower and pouring cold water, you know, from the tap. That'll make it
water.
worse. Yeah, or bottled water, that'll make it worse.
Is there a difference with distilled water?
I don't know. I don't know about distilled water, but fresh water will release more toxin because it'll rupture those cysts.
Okay, real quick, the last two. What's the best way to avoid getting stung or cut while swimming?
Well, I think proper protective gear, okay, if you're out in the ocean, you're surfing or you're in a rocky area, you can wear like little foot coverings and your wetsuit or at least a rash guard to cover your tops and bottoms to prevent scrapes and prevent sunburn as well.
Okay, and then we're coming back to this last question. What items, Dr. Lom, would you recommend I put in a beach first aid kit? Most people, I would suspect, don't do this already.
Yeah, they don't have one because we're, you know, pretty close to, from any beach, it's not far to, you know, somebody who can help you here on Guam. But still, it's good to have that in your car, and it's easy to pack some vinegar, some Band-Aids, some gauze, some gloves, because if you're dealing with somebody else's cuts, you don't want blood all over your hands. I mentioned gauze and Band-Aids, and maybe some topical antibiotic ointment, and you could also pack in a little bit of Tylenol or Motrin to help you with pain if you have any condition that hurts.
And possibly the most important thing you can have is a well-charged cellular telephone.
Yeah, that's right.
All right, thanks so much,
Good
Doc.
for you. Thank
All right,
you.
and stay tuned because we will be back right after this.